Good morning, everyone. We're so glad that you all could join us. My name is Dana Brooks, and I'm the Director of Admissions at PCOM South Georgia, which is the Philadelphia College of Osteopathic Medicine.
Good morning. My name is Kimberly Butler. I work in Office of Admissions on the Swanee campus.
Good morning, everyone. My name is Melissa. I am an admissions counselor on the Georgia campus as well.
Good morning, everyone. I'm Fatima in admissions, and I'm also on the Georgia campus Swanee location.
All right, so what we're going to do today, we're going to tell you about PCOM and what all we have to offer you. We're also going to do a little activity with you. We're going to tell you a story. I know that sounds very juvenile, but it's going to be fun. So if you can, grab a piece of paper and something to write with. And so while you're doing that, I'll go ahead and get started and tell you a little bit about PCOM, and I'm going to share my screen with you all. So let me know if you can see it.
We can hear you.
Okay, you can see the presentation too?
Yes, we can see it.
All right, good deal. So just to start off, telling you a little bit about PCOM, Philadelphia College of Osteopathic Medicine. Our main campus is in Philadelphia. We started in 1899, so we're super old, over 100 years. In 2005, Philadelphia College of Osteopathic Medicine extended to Georgia. So they were granted approval to move to Georgia to help address the shortage of healthcare workers in the state of Georgia, focusing on the metro Atlanta area. So in 2005, they opened a campus in Sewanee, which is around the Atlanta area. Since they've been there, they've graduated over 800 graduates who have stayed in practice medicine in Sewanee, so all over the North Georgia area. So back in 2015, they were granted another approval to come to South Georgia, and it made perfect sense since they had such a huge impact in the Sewanee area to extend their reach to help South Georgia increase their physicians shortage. So I'm from the South Georgia campus, and we've been here since 2018. We'll be welcoming our third class here in South Georgia, and our focus is to increase the physician workforce in rural Georgia. So what we're going to do to start off is, like I said, we're going to tell you a story. But what I want you to do throughout the story, I want you to jot down every health professional that you hear in the story. All right, y'all ready?
Do you mean name or occupation of the health professional?
The name. So like a nurse,
Okay,
doctor, emergency tech. All righty. So the story is about a guy named Jay. So one day Jay was driving his car to work, and all of a sudden he got into an accident. Everything went black. So police were called to the scene, paramedics were called to the scenes, as well as forensic investigators. They were all on the scene of the accident. Jay was transported to the ER, where he was greeted by a team of medical professionals and triaged by nurses. After he was seen by a physician assistant, an evaluation, and talking to Jay, they decided that he may need, because his leg was giving him so much trouble, they decided that he would need to go and have x-rays of his legs. So the x-rays revealed that Jay had a broken leg. So he had to go to the OR, to the operating room, to see an osteopathic orthopedic surgeon where they conducted the surgery. So after the surgery, he was then transferred to the hospital room. And there in the hospital, he was cared for by nurses, and his overall care was overseen by an osteopathic hospitalist. So Jay recovered and he was discharged to go home. His doctor prescribed him medicine to take. So on the way home, he stopped by at a local pharmacy to pick up his medicine that the pharmacist prepared. Jay went to his primary care physician for a checkup. After the accident, and then the physician referred him to a physical therapist. So the physical therapist worked with him, with his legs and got it back to full strength through using certain stretches and exercises. So over time, Jay continued to go to physical therapy until he fully recovered from the accident. After that, he went back to see his primary care doctor because he was feeling anxious. He started experiencing anxiety. So his doctor referred him to a licensed professional counselor. So the counselor determined that he was experiencing PTSD, which is post-traumatic stress disorder. So the counselor decided to use cognitive behavioral therapies to help Jay. After that, he felt much better and he was able to put the event behind him, and this ended his medical care in regards to the accident. All right, so that was a very short story. So if you all want to, you can take yourself off mute, or you can either put into the chat the health professionals. How many did you count in there? You will have to help me because I can't see everybody.
So some people are saying 8, 9, 11, 7, 9.
Okay, so we can go over them. So the paramedics, there are paramedics there. There were forensic investigators there, nurses, PAs, physician assistants, osteopathic orthopedic surgeon, the osteopathic hospitalist, a pharmacist, a primary care physician, the physical therapist, and also the licensed professional counselor. So in total, I got 10. So as you can see, we just wanted to give you an idea of what it takes, a whole team to really help complete someone's health care after a traumatic event when they're injured. So now I'm going to hand it over to my colleagues to go over all the programs that we have at PCOM.
Awesome. Alrighty, so in this story, I know you all heard osteopathic a lot, and you probably are wondering, what's osteopathic? Or some of you probably already know. But there are two practicing physicians within the United States. We have your allopathic physicians and your osteopathic physicians. Both receive the same type of training within school, but with osteopathic, you learn an extra skill, and that extra skill is osteopathic manipulative medicine. So you'll hear OMM a lot. So you can go to the next screen. So in that story, there were 3 DOs in this story. You heard of the orthopedic surgeon, the hospitalist, and the primary care physician. That being said, again, I said the programs are similar for MD and DO. It's a 4-year program, and you must have a bachelor's degree to apply. After that, you'll do a residency, and you'll have to complete a residency. And the residencies can be anywhere from 2 to 7 years, depending on your specialty. Usually you find DOs in primary care, but as you see within the story, you see them in other places as well. So yes, DOs can be surgeons, pediatricians, emergency medicine, dermatologists, all that you see there. And each of those different specialties will require a certain amount of years of residency. So residency is still a learning process for you, but the good thing about the residency is you're still learning, but you're also getting paid to learn.
Doctor of pharmacy. So in the story, they talked about Jay had to visit the pharmacist just to help with the medication, which was released from the hospital. So with our pharmacy program, it's a 4-year program, and it happens once you graduate from college, or you might not even need a college degree. You can actually fulfill a number of prerequisites or pre-college courses to go on to a pharmacy program. The role of the pharmacist continues to evolve with several opportunities. There are retail pharmacists, and that's your CVS, your Walgreens, or you have research pharmacists and pharmacists that work in compounding labs, or pharmacists that work in pharmaceuticals, as well as government agencies. So pharmacists, they play an essential role in the healthcare team, making sure that the patient is getting their medications on time, making sure they're taking their medications in a timely fashion, and they work very closely with the physician to make sure things are working properly as along with their medicine and their treatment plan. Next slide.
So in this story, Jay had broken his leg and he had to go see a physical therapist so he could be rehabilitated. Our physical therapy program is only located on our Georgia campus. It is a 3-year program, and PTs are considered to be rehabilitation specialists or also movement specialists. So PTs, when you go see them, they're going to try to do their best to get you functioning back to your normal state, or as best as they can, maybe even better than how you functioned previously. For example, Jay, he would have exercises to get his leg feeling better. That way he could walk again. PTs are focused on preventative care, and they also treat patients with chronic conditions and illnesses or injuries.
In the story, there was a physician assistant saw Jay when he entered the emergency room, and the PA ordered the X-ray of Jay's leg. Physician assistants, they work directly with DOs or MD to perform the exact same tasks. PAs, they are overseen by MD or DO to be supervised. The PA program is located in the Georgia campus as well as the Philadelphia campus. Our PA program is a 26-month program, so about 2 years, and you need a bachelor's degree to apply. PAs, they work cohesively with the MDs and DOs. You can't have one without the other. It's a team effort when regarding patient care with a doctor and a physician assistant. With the PAs, they work directly with the patient, lots of patient care. A lot of patients would say that the PA is like their best friend in a sense, because with the doctor, while they are there to deal with the patients, the PAs have more communication with the patient workup, treatment plan, etc. So the PAs are always there making sure that the patient is taken care of. Next slide.
So forensics, masters of science and biomedical sciences. So in the story, there was a car accident, and usually when there is an injury or of some type in a car accident, you're going to have a forensic investigator sent to the scene so they can investigate it. So this program is a 2-year program. Of course, again, you will need your bachelor's degree, and it's forensics medicine and not forensic science. But some ideas of what you can think about of as far as jobs after completing this is within law enforcement, a coroner's office, or medical examiner's office. So think of those type of things, and for this particular program.
So in this story, Jay was experiencing PTSD caused by the accident. So Jay actually went to go see a mental health counselor. We do have a Master of Science in Mental Health Counseling in our main campus in Philadelphia. It's a 2-year program, after which students take an exam and become licensed professional counselors. And many of them see clients in a variety of different settings to help with really any kind of mental health needs that a patient may have.
All right, so that is the end of our story, and just talking about all the programs that we have. And as you can see, like we said earlier, that it does take a team and that everybody works together. we know that you're part of HOSA, so we know that you are interested in healthcare. There's something about healthcare that maybe you're exploring to pursue when you get into college. So we hope that we really helped you in some way, and maybe see like how different careers are, the pathway to get there. We would definitely love to take any questions that you may have at this time, whether it be about a career that we talked about or about PCOM. And I'll go ahead and stop sharing. Does anyone have any questions? You can either take yourself off mute or put them in the chat. No questions. Everybody is like still almost asleep. It's a little early.
There's no questions in the chat yet, so
Okay.
yeah.
All right. Well, if you all don't have any questions, we do want to thank you all for joining us this morning. If you have time today, look us up on the website. Feel free to reach out to us at the admissions office. If you have any questions, you can also reach out to our admissions inboxes that Ms. Kimberly just put in the chat. We also have virtual tours on our website. So if you want to go and look, check out to see what our different campuses look like, you should do that as well. And it's pcom.edu. But we hope you all have enjoyed your conference, and we're so glad that we got a chance to talk with you all today, and we hope you have a great rest of your day.
Thank you, everyone.
Thank you, guys.
Thank you.
Thank you.